Free CNA practice test 50 questions. Question 1. Which document describes the tasks a CNA is legally allowed to perform? The resident's care plan, the CNA's job application, the state's scope of practice, the facility's menu. The scope of practice defines the legal limits and responsibilities of the CNA role in that state. Question 2. Which of the following should be reported to the nurse immediately during a bed bath? The resident is tired. A new red area on the resident's tailbone. The resident wants to wear a blue shirt. The resident is talkative. New skin breakdown or redness over a bony prominence is a sign of a potential pressure ulcer and must be reported immediately. Question 3. When should standard precautions be used? Only for residents with known infections. Only when the resident is coughing. For every resident at all times. Only when the nurse tells you to. Standard precautions are designed for use with all patients to reduce the risk of transmission of pathogens. Question 4. A resident is nearing the end of life. What is the CNA's primary role? To encourage the resident to eat a large meal, to provide comfort and emotional support, to discuss medical treatments with the family, to ignore the resident since they are dying. Palliative care focuses on comfort, dignity, and support for both the resident and their family. Question 5. A resident is having a seizure. What is the CNA's priority? Place a spoon in the resident's mouth. Hold the resident down to stop the shaking. Protect the resident from injury and clear the area. Run out of the room to find help. Safety is key. Protect the head and clear objects away. Never put anything in their mouth or restrain them. Question 6. A resident with Alzheimer's disease is wandering the halls. What should the CNA do? Lock the resident in their room. Tell the resident they are being naughty. Gently redirect the resident to a safe area or activity. Tie the resident to a chair. Redirection is a safe and effective technique for managing wandering behavior in dementia patients. Question 7. Which of the following is a sign of dehydration? Clear, pale yellow urine. Moist skin. Dark, concentrated urine. Increased appetite. Dark, strong-smelling urine and low output are classic signs of dehydration. Question 8. What is sundowning? Increased confusion and agitation in the evening hours. Sleeping all day and staying up all night. A skin condition caused by the sun. The resident feeling better at the end of the day. Sundowning is a phenomenon where confusion and behavioral problems worsen as daylight fades. Question 9. When communicating with a hearing-impaired resident, the CNA should shout as loudly as possible, speak slowly and face the resident directly, only use written notes, avoid talking to them. Facing the resident allows them to see your lips and facial expressions, and speaking clearly helps communication. Question 10. What is the most effective way to prevent the spread of infection? Wearing gloves at all times. Washing hands frequently. Using antibacterial spray on everything. Keeping all residents in their rooms. Hand washing is the single most important practice in preventing the spread of infection. Question 11. Which of the following is a normal part of aging? Loss of all memory. Slowed reflexes and reaction time. Incontinence. Constant pain. While some decline is normal, like slower reflexes, things like total memory loss or incontinence are not normal parts of aging. Question 12. What is the first step in performing any procedure on a resident? Gather supplies. Identify the resident. Wash your hands. Explain the procedure. Hand hygiene is always the first step to prevent infection before touching a resident or equipment. Question 13. What is the proper method for cleaning the perineal area of a female resident? From back to front. From front to back. In a circular motion. With a scrub brush. Cleaning from front to back, cleanest to dirtiest, prevents the spread of bacteria from the anal area to the urethra. Question 14. A resident's tray has a full glass of water, but the resident is on NPO status. What does this mean? Nothing by mouth. Next patient only. Needs physical observation. Nutrition per oral. NPO stands for nil per os, meaning nothing by mouth. No food or water should be given. Question 15. Which pulse site is most commonly used for taking a routine pulse? Carotid, radial, brachial, apical. The radial pulse, at the wrist, is the most common site for measuring heart rate in adults. Question 16. What is a common sign of a urinary tract infection, UTI, in an elderly resident? Sudden confusion, increased appetite, better sleep, improved mobility. In the elderly, UTIs often present with cognitive changes or delirium rather than just physical symptoms. Question 17. What should a CNA do before entering a resident's room? Walk right in. Knock and wait for permission to enter. Call out the resident's name from the hall. Check the resident's chart. Knocking is a matter of respect and privacy for the resident's home. Question 18. A resident refuses a bath. What should the CNA do? Force the resident to bathe. Skip the bath and try again later. Tell the resident's family. Document that the resident is difficult. Residents have the right to refuse care. The CNA should respect the refusal and try again at a different time. Question 19. When dressing a resident with a weak right arm, which arm should be dressed first? The left arm, the right arm, both arms at the same time. It doesn't matter. When dressing, always start with the weak or affected side first. Dress affected/weak. Question 20. If a resident is in a vest restraint, how often must they be checked? Every 15 minutes, every hour, every 2 hours, once per shift. Residents in restraints must be monitored at least every 15 minutes to ensure safety and circulation.